You can't help where you or someone you love has a mental health crisis, but the help that you or they receive really does depend on where it happens. 1 in 3 counties in Colorado has a state-funded program to respond to mental health calls with someone other than officers with guns. Our Steve Steger looks into what's stopping every community from trying a new approach.
Summit County Sheriff Jamie Fitzsimons calls his co-responding crews, complete with clinicians, the future of policing. But he will tell you the future takes a lot of work.
And I hear people try to make it sound so simple. You know, there's millions of dollars coming down from the state. You just need to apply for it. Then you stand up a team and you just go do it. And it's not that easy.
Fitzsimons funds his mental health program in part through Colorado's Behavioral Health Administration. The BHA told us today they fund co-responder programs in 24 of Colorado's 64 counties. A spokeswoman told us there are other co-responder programs that don't get state funding, but the BHA funds the majority of these programs.
There are far too few of them.
Vincent Achidi is the president of Mental Health Colorado, advocating for these programs all over.
Universally, they are not available everywhere they need to be available or all the times they need to be available.
Fitzsimons says he thinks what's stopping some sheriffs and police chiefs is the unreliable funding for these programs.
It takes a lot to go after these grants, and they're never guaranteed the next year in the same amount. I had one grant that I got $385,000 one year and $40,000 the next. So now I have a deficit. So now I'm scrambling around with hat in hand trying to make up that deficit.
We are always begging. We go with our hat in our hand, as you say, as if this were some experimental new thing that nobody had any confidence in, but we're going to give it a little whirl. Nobody is arguing. I've never heard anybody arguing about the validity of this programming.
What's going on, man?
But Achidi also says this will take a culture adjustment to make sure anyone calling 911 at any time gets the help that they need.
But there ought to be cost shifting within agencies and communities to ensure that that's the case.
You're live in Idaho Springs, in Clear Creek County, where Christian Glass, 22 years old, was shot and killed during a mental health crisis by the Clear Creek County Sheriff's deputy. There's a vigil for him here scheduled later tonight. To give you an idea of the need that exists, the BHA, the Behavioral Health Administration, tells us that in the last fiscal year, that's between July of 2020 and June of 2021, the last that they have data for, the different departments that are funded by this program made contact with 25,900 people, Kyle. The question is, how do you get more communities on board like Clear Creek County, where there is no co-responder program right now?
It's striking, Steve, to hear advocates talk about the fact that they're still out there begging for money like this is some unproven thing. And I wonder if it's just the fact that we've really only started talking about it as a wider community pretty recently.
Yeah, you know, in Summit County, for 1,600 calls since the beginning of 2021, in those cases that they have responded to, 1,600 calls, no arrests, no uses of force, and only a handful of people that they had to refer to a hospital or another mental health facility in that short term. The goal is to really get these people stabilized, because if they're in crisis and you can get them stabilized, you might save them a pretty tremendous bill for transportation to a hospital or just any other expenses that come along with hospitalization in a case like this. So just a more serious conversation about this in all communities across Colorado really necessary.
Because everybody shares the same goals. They want the person at the center of it to come out okay, safe, and they want the responders to come out okay and safe. Steve, thank you.